Hello, YouTube family. Welcome to Dr. G Pediatrics. I am Dr. G, board certified pediatrician. Today's video is about newborn feeding tips, newborn feeding full times for a mom. It's that first couple of weeks of life. Is my baby getting enough? Is my baby getting enough breast milk? Is my baby getting enough formula? One of the most common questions that I get at the first couple of visits with patients. And so I think it's super important. I hope you guys find it helpful. So these are some of the newborn feeding things that I discussed, tips I hope you guys found useful. So one of the first things that I always tell parents is to take a deep breath. I know that wasn't groundbreaking. That wasn't like, ooh, but it's true. It's true. You know, it's true. It's so important because we're on edge, we're stressed, and our newborn baby can sense that. They can sense that if whether you're breastfeeding or formula feeding or exclusively pumping, you know, it's a transitional time. It's a new time. So just try not to stress. You can always be concerned. I always say there's nothing wrong with being concerned, but worrying and stressing is not going to help you, and it is not going to help the baby. Okay? Okay, great. All right, now for like the real tips. Okay, newborn hunger cues. Okay, so this is the ideal time to feed your newborn when they are providing these early cues that they are ready to feed and they are hungry. This may include rooting, which is where you stroke it and they're turning their mouth towards the breast or the bottle. They may start sucking on their hand like that. Those are early hunger cues for us. And that is the best time to feed, especially I think when you're breastfeeding, because that is when you can, you know, kind of get the baby ready. You can do some skin to skin time, you know, take your time getting things ready, especially if you're trying to like figure out this latch, or you may be using a nipple shield. So the early hunger cues, that is the best time to start feeding the baby, or, you know, get that preparation going. Crying is what we consider a late hunger cue. So if your baby is crying, yes, I mean, if they're getting a bottle, they're just and they're gonna be fine. But if you are nursing and the baby is crying, it may be more challenging, especially those first couple of weeks, to get that latch, and could just make your anxiety levels go up. So look for those early hunger cues. Additionally, the opposite to that is then also watching your babies, their signs of fullness. So if they start to slow down on their suck and you don't really hear it quite as much, and there's you know, they're not as voracious as they were at the beginning, that could be a sign of fullness. Also, newborns at baseline, they keep themselves flexed like this. So their arms are up like this, their hands are clenched together. But you can see that once a baby is like full, a newborn, they start like relaxing a little bit. And you may notice that from this, they go to this. And it's like, okay, I'm full. I feel good. So that's good, right? So start looking for those signs of fullness, because, you know, you don't want to overfeed the baby. It's more likely to come back up, and that's a whole different stress, which we are not targeting today, but I can always do that video on newborn spit up, because that's stressful. Okay, so we talked about newborn hunger cues. We talked about newborn fullness cues. Another tip that I'd say is, this might create controversy, but I'm going to say it. I don't really feel like a rigid feeding schedule is most ideal at the first couple of weeks of life. I know there are like programs and books where they talk about like this very, you know, structured feeding schedule. If you like it, I love it for you, not for me. And not what I don't usually counsel my patients very early on to have a very rigid newborn feeding schedule, because newborns do well at feeding on demand. Going by their hunger cues, I think, is more helpful. Well, I would say I know. Because I'm gonna pull my mama card, but I'm gonna also pull my pediatrician card. Okay? Because the hunger cues are, it's this what your baby's using to tell you. So go by that. Don't go by the clock saying the baby's not ready to feed yet. It's only been an hour and a half. But your baby's hungry. And I am going to commit a confession to you that I was that mom with my first daughter at the very beginning. She was breastfeeding. This was like a couple of days being discharged from the hospital. I was in residency, a pediatric resident. So like, I'm like by the book, and I had just nursed her, and it was an hour and a half. And my mom said, oh, honey, I think she's hungry. I was like, no, Mom. Check the schedule. She just ate an hour and a half ago. We don't want to overfeed her. I'm sorry, Layla. You were hungry. You were hungry, and I was just letting the books cloud my judgment. Or not even knowing all the books, because had I studied the full part, I would have known that I really should be focusing on feeding by demand at this point and not just being structured on a schedule, because that's going to be the best way to tell. And additionally, newborns kind of cluster feed when they are going through growth spurts, which we'll see usually at the first week of life, second week of life, fourth week of life. They may want to they cluster feed, meaning that they're feeding closer together, because their body needs that increased calorie demand because they're growing. There's so much growth going on for a newborn. Brain growth, all different types of growth. So they need that extra calorie demand. And if they're telling you that is just instinctual. They're telling you, I'm hungry, feed me. I know the schedule that you read about and your cousin blogged about is supposed to be like the gold standard. But if your baby is telling you she's hungry, feed the baby. And I'm saying this to my younger self. You should have fed that baby. Okay. All right. So that to me is a great feeding tip. I mean, I found it useful after the fact. My second daughter, Gracie, she got it better. I was a more seasoned mom and pediatrician at that point. Anyway, I digress. All right, so you're like, okay, well, if you're nursing, you don't know the volume that your baby is taking per feed, right? If you're formula feeding, or if you're exclusively pumping, where you're pumping the milk and putting in the bottle, you have a clear-cut guideline of what your baby is taking in. And sometimes that is just, just a sigh of relief. That used to be a sigh of relief for me. And so when I have parents that are nursing, they don't know. And so that's stressful. Like, I don't know I don't know how much milk came out. So a great way to tell that within the first couple of weeks, I would say first 6 weeks of life, is tracking the baby's wet diapers, because that is a gauge that they are taking in enough to let it on out. So for the first 1 to 2 days of life, they should have 1 to 2 wet diapers and 1 stool diaper. Then for the second to the 6th day of life, we're looking at about 5 to 6 wet diapers and maybe approximately 3 stools. That varies because some babies just poop a lot. They just poop a lot. And some babies may not poop quite as frequently, but that's just a range. And then when we say wet diapers, we're not talking in a newborn period about soaked. They're not going to soak the diaper. Just enough to give you that little line that they peed. That's considered a wet diaper. And then after a week to about 6 weeks of life, 6 to 8 wet diapers in a 24-hour period. And again, approximately about 3 stool diapers is what we would anticipate as a good way to track that they're getting what they need. And then, of course, okay, weight gain. We're talking about feeding. We want to know that the baby's gaining weight. When should the baby be, above their birth weight and that sort of thing. So a newborn, I don't know if any parents who haven't had their baby yet are watching this video. So I will say it is completely normal for a newborn to lose weight after they are born. a lot of times they are going to be less than their birth weight on that 3 to 4 day old checkup. That's normal. A lot of that is water weight that they're losing. So newborns, we expect a normal weight loss at about 10% of what their birth weight is. So that's something that we expect within that first week of life. So then after the first week of life, you're feeding that weight gain should be about getting back to birth weight by 2 weeks of age. So that gives you leeway to, the baby's feeding and you're not sure and all that, but you don't really have to be above birth weight. We just want you to be back to birth weight by 2 weeks of age. So then after that, an average weight gain or normal weight gain is going to be about 20 to 30 grams per day, which equals to about an ounce a day on average. That is what we consider a healthy newborn weight gains pattern. And that's what we're looking at. So we're not expecting babies to just gain this like enormous amount of weight. Some babies gain weight more than that, but we're just looking, okay, like, is this baby getting enough to have the weight gain that they need for the continued development that's going on in their brain? That's super important, and then in their body growth. So those were those newborn feeding tips that I usually discuss that I thought would be beneficial. I hope you found it helpful. If you did, let me know and share it to someone that you think may find this helpful. As always, stay great and have an awesome day. Bye.